It is now my honor to introduce to you to a very good friend who is going to open today's proceedings. And she is no other than Dr. Karen Gibbs, who is the president of the Academy of Clinical Electrophysiology and Wound Management of the American Physical Therapy Association. Dr. Karen Gibbs received her entry-level Master's of Science in Physical Therapy in 1999 and transitional Doctor of Physical Therapy in 2003 from the University of the Pacific. She was certified by the American Board of Wound Management as a certified wound specialist in 2001 and completed her PhD in adult education at Texas State University in 2011. Dr. Gibbs has practiced as a physical therapist in outpatient skilled nursing and acute care settings. She's currently a professor in the Department of Physical Therapy at Texas State, where she teaches wound management and examination techniques and lectures in structural anatomy, pathophysiology, and therapeutic interventions. Dr. Gibbs has been a member of the APTA since 1999, and as I said before, she currently serves as president of the Academy of Clinical Electrophysiology and Wound Management of the APTA. Please help me welcome Dr. Gibbs, president of ACEWM. Karen?
Hello, and welcome to the 7th Annual Hands-On Diagnostics Symposium and Summit, the first virtual international clinical conference in electromyography and musculoskeletal ultrasound. My name is Karen Gibbs, and I am the president of the Academy of Clinical Electrophysiology and Wound Management, a section of the American Physical Therapy Association. The ACEWM is proud to be a co-sponsor for this conference. A component of the ACEWM's vision and mission is to be the premier organization for physical therapy professionals and students in electrodiagnostics and neuromusculoskeletal ultrasonography, and to advance, promote, and support evidence-based practice, education, and research in these areas. The ACEWM offers special interest groups in electrodiagnostics, led by Dr. Quinn Millington, and in neuromusculoskeletal ultrasonography, led by Dr. Mohini Rawat. Both of these groups offer opportunities for mentoring, leadership, continuing education, and in setting practice expectations. So we have a place for clinicians, educators, and researchers at all levels. The ACEWM's Electrodiagnostics Special Interest Group is very active in content-related legislative and practice issues and supporting ACEWM members in protecting and advancing this highly specialized area of PT practice. Many of our members serve the American Board of Physical Therapy Specialties as item writers, specialty council members, and board members to ensure the specialty certification for physical therapists in clinical electrophysiology remains a respected, challenging, and highly sought-after credential. Our special interest group is a robust representative body, and with your support, it will continue to grow and become an even stronger advocate in electrodiagnostics. Likewise, under Dr. Rawat's leadership, our somewhat new musculoskeletal ultrasonography special interest group also has the potential to be a leader in setting practice expectations and meeting the educational and research needs of physical therapists who utilize diagnostic ultrasound. My deepest appreciation goes to all of our current special interest group leaders and active members who volunteer so much of their time and energy. Also, thank you to all the members who support the organization just by joining the ACEWM. The sky really is the limit on what can be accomplished when we work together. Please enjoy the conference. We're very glad you're here.
Karen, thank you so much for delivering the opening for this first international conference in EMG and MSK ultrasound and the 7 HODS annual symposium. So, my friends, on behalf of the Hands-On Diagnostics Franchising President and the Chief Executive Officer, as well as the boards of directors of the American Academy of Clinical Electrodiagnosis, AACE, and the American Academy of Musculoskeletal Ultrasound, AAMU, I would like to welcome all of our HODS partners and all of our other colleagues here in the United States and abroad to this international conference and 7th HODS Symposium. I want to give a sincere thanks to our event co-organizers, the American Physical Therapy Association's Academy of Clinical Electrophysiology and Wound Management, and its special interest groups on electrodiagnosis and neuro-MSK ultrasound. Many thanks also to our event sponsors, ACEWM, Paychex, Weave, and Econologics, who have made this event possible. Thank you very much. For the past 6 years, this event takes place live. Yet this year, due to the unprecedented COVID-19 situation, we are getting together via this online platform. We want to make the best of the situation, and this is why we extended this event to our international friends and colleagues who are attending today from all continents around the globe. Technology and innovation brings together some of the most prolific minds and scientists of our professions. COVID-19 has brought in front of humanity a huge challenge, and it would be perhaps appropriate to spend time to talk about the pain and suffering and that many people have endured, or talk about the over 1 million deaths because of COVID-19 worldwide. Instead, I will offer a huge acknowledgement to those who have suffered and still suffering from the consequences of this disease, and I will remind them that as humanity has done in the past, we will again overcome this situation and life will go on. Moments like these bring the best out of most people, and kindness, cooperation, and understanding prevail. HODS has been in the forefront of the fight against COVID-19 and in the preservation of your practices in the midst of the pandemic. HODS started hosting daily town hall meetings since early March, bringing you all relevant data you need to deal with the pandemic as private practice owner. HODS hosted the first COVID online forum that brought together experts from all fields to provide you with valuable information on compliance, telehealth, insurance, PPP loan help, and all other information, and helped you navigate through the crisis. HODS sponsored and funded the PT for Heroes campaign, a nationwide campaign that brought the PT, OT, and SLP professions in the front of major media organizations while helping our first responders. Well, I'm truly grateful that all of you have made time from your busy schedules to be here today. Our purpose is to come together to share ideas and create strategies for the advancement of our professions for beyond 2020. We're going to spend some time today looking at a few of the major challenges that physical therapists and other healthcare providers face, and together look for solutions. We have some partners with us here who joined HODS as long as 7 years ago. We have some who joined us a couple of months ago, right in the middle of the pandemic. And we have with us many others who are students of AACE and AAMU or other professionals who have an interest in the areas of electromyography and MSK ultrasound. We represent a range of backgrounds and focus areas, but we share the same commitment. We all want to help our patients achieve better health through obtaining an accurate diagnosis and proper management for their health challenge. And this through a wide range of technologies: electrophysiological, neuromusculoskeletal, ultrasound imaging, vestibular testing, and more. There are a lot of ways that you could be using your skills and knowledge. At the end of the day, all of us simply want to help people, and we want to help our professions, advancing them to new heights of both clinical competency and professional autonomy. I would like to take a moment to talk about our HODS partners. As I reflect on the past several years and the growth we have seen, I feel enormous pride and gratefulness. All of you should too. There are a few key accomplishments that I would especially like to highlight. Our HODS family has now grown to more than 185 facilities. We have expanded across 26 states, where you are carrying out some truly outstanding work, servicing your patients and your referring doctors while giving back to your communities in so many ways. Over the past several years, our HODS partners have performed thousands of tests and helped thousands of patients while driving steady revenue growth in their facilities, creating affluence and expansion for their businesses. All through this process, the HODS partners, faculty, staff, and board made significant strides on a nationwide level. Our rate of success in the board certification exams, both of EMG and MSK ultrasound, now ranges from 90 to 100%. Congratulations to all of you. Several HODS members have been helping our national associations as volunteers and elected as board members of various organizations such as the Academy of Clinical Electrophysiology and Wound Management of APTA. HODS has been also a great advocate and supported the APTA and its various components. Many HODS partners have worked closely with APTA to advocate and enhance the position of physical therapists in various states in regards to diagnostics. Elsevier's Journal of Bodywork and Movement Therapies has created now a diagnostic methods section in the journal, which I'm proud to edit. The journal features articles on MSK ultrasound and electromyography in every issue, which I encourage you not only to check out, but to submit your articles. This very journal, published in January of this year, our multi-center research study sponsored by HODS. This very study had stunning results that hold some very important implications for the physical therapy profession and especially on our patients. Physical therapy patient management was changed in about 61% of patients as a result of the EMG testing results. Meanwhile, 90% of patients agreed that they were better able to understand their problem and better able to manage it because of the answers they got through diagnostic testing performed in the physical therapy clinic. These results are groundbreaking as they help support the new paradigm of physical therapy practice introduced by HODS. My friends, we're in a unique time in the healthcare professions and especially the profession of physical therapy as private practitioners. We are at the crossroads of deciding to fundamentally transform our profession, to the most powerful ones among the healthcare professions, or to give up and succumb to the financial challenges of our time. Remember that Medicare just recently announced an additional 9% reduction in all physical therapy services starting 2021. That is on top of another 15% if physical therapy is provided under physical therapy assistant care. Quite frankly, these trends aren't going to be ending anytime shortly. All of the data indicates that we can expect to see reimbursement rates continuing to decrease for PT visits. Do you remember my words from past conferences, symposiums, and webinars? I have been talking and predicting Medicare cuts for the past 3 years now. And if this is not enough, the peer-to-peer group from the PPS APTA, the private practice section of the APTA, reported average annual profit margins for physical therapy for 10 to 12%. Just imagine what will happen to this margin after the 9% cuts goes into effect. I know that numbers can seem to paint a pretty bleak outlook for private practice owners. This shows you how much a slim profit margin can dangerously affect your practice with the smallest rate reduction by an insurance company. This is the reason that you need to create a healthy 30% or greater profit margin in your practice to be able to withstand any similar rate or regulatory changes. Meanwhile, there are other major challenges for our professions and for the country as a whole. First, let me quickly say that despite the fact that the opioid crisis is at an all-time high, much of the problem has been skewed by the COVID-19 pandemic. The opioid epidemic is now the single worst crisis in American history. But how our professions can significantly contribute to the solution of this problem? Obviously, this is a multifaceted challenge that requires efforts in many areas, from innovative approaches to rehab to policies that focus on restoring economic hope to depressed areas. But alongside education, the physical solution to this problem rests in treatments and therapies that can help patients without the use of such opioids. This is where physical therapy, in collaboration with other healthcare professions, come to play a very important role by providing treatments that are effective to patients' problems without the use of such opioid drugs. But besides education, the physical solution is treatments and therapies that help with patients without the use of opioids, especially those patients who suffer from chronic pain. However, to treat a problem, one must first ascertain its root. Physical therapists and other healthcare professionals rely on a variety of physical tests to identify and diagnose a patient's dysfunction. These tests are usually performed during their initial evaluation or examination. These physical examination tests have a certain degree of sensitivity and specificity, and to the degree that they are reliable, then they can identify the specific pathology of that patient. However, many of these tests have very low degrees of sensitivity, allowing a large number of problems to be misdiagnosed or go undiagnosed, while patients continue suffering from pain. Examples of these low sensitivity and specificity tests include some of the most widely used physical examination tests for the most common pathologies. When the real source of the patient's problem is not diagnosed, then it remains untreated with physical therapy. Then the physical therapy outcomes can be poor or mediocre. This leads to a continuation of the patient's problem. This leads to disappointment and dissatisfaction from the patient's side. And of course, this turns the patients to other resources to take care of their problem, and some of them are opioid medications. An article in Muscle and Nerve entitled "The Usefulness of Electrodiagnostic Studies in the Diagnosis and Management of Neuromuscular Disorders" found that electrodiagnostic studies led to a change in diagnosis in more than half the patients in this study, and led to a change in management plan in more than 60%. But how about physical therapy? Would the same apply? The HODS multi-center study with over 450 participants found very similar results, as I showed you earlier, with the muscle and nerve study. And we believe this is mostly because these diagnostic tests, such as electromyography and musculoskeletal ultrasound, they have much greater degrees of sensitivity and specificity for the most common neuromusculoskeletal disorders. So a proper diagnosis can be derived. It becomes apparent that if we want to be more effective with our patient treatments, if we want to make an even bigger difference in our patient problems, we have to be more effective and more accurate in the way we diagnose patient problems. So electromyography testing and MSK ultrasound offer higher sensitivity and specificity outcomes for the most common problems, as I mentioned, that can lead to more accurate diagnosis and eventually more effective treatments and better patient outcomes. We hear this from you, our HODS partners, with your examples every single day. We had a patient come in after wrist fracture, completed PT, and was doing well, Dr. David Hott, a HODS partner, says. She then contacted us one morning when she could no longer move her thumb. As a HODS-approved diagnostic center, we did an MSK ultrasound on her thumb tendon and found it was ruptured. We sent her to the orthopedic surgeon for repair, and she's now doing exceptionally well because of us being able to help her with the testing. An insurance company was denying a firefighter a meniscal arthroscopy due to poor MRI quality. We're a HODS-approved diagnostic center, and we decided to do an MSK ultrasound for his knee. After we sent the results to the patient's orthopedist, he forwarded them to the insurance company, and they were convinced to allow the MD to get another MRI, which confirmed the MSK ultrasound findings. The patient had a significant flap tear and underwent a successful meniscectomy. The MD and the patient were extremely happy because we were able to help them, says Dr. Brad Braceville, HODS partner. An orthopedic doctor recently called us and asked us to do an EMG test on a patient because he and a neurosurgeon disagreed on the cause of the foot drop, Christina Panetta said. EMG was able to confirm radiculopathy, which is what the ortho was suspected. Now the patient is doing already better because we had the proper medical and physical therapy management. We recently had a patient that came in for status post total knee replacement and knee and foot pain and numbness. As a HODS-approved PT and diagnostic center, we did an EMG and found out that the real issue was an L5 radiculopathy. Her secondary back pain and primary knee pain numbness resolved within a few visits. This is all because we're implementing advanced diagnostics in our practice, says Dr. Nathan Shields. And the list goes on and on and on. Diagnostic testing can help the clinician achieve far better patient outcomes and create a more decisive, positive impact in society. So the question is, how is HODS planning to help the profession and patients? First of all, we must increase awareness to both the medical professionals and to patients. To further increase awareness to physical therapy and medical professionals, we are continuing the quarterly publication of our magazine, Diagnostics for PT, which features a wealth of information about the value and clinical utility of diagnostic testing. At the same time, we're encouraging you to submit diagnostic testing articles to the diagnostic section of the Journal of Bodywork and Movement Therapies. We're also asking you to actively participate in our professional associations, the APTA, the ACEWM, and the AIUM. HODS is the sponsor of the weekly town hall event, Coffee with a HODS Personality, and thus far, we're sponsoring Coffee with Angie, Coffee with Christina, Coffee with Nathan, and Coffee with Will. These amazing professionals share with you their secrets for business success. Join them. HODS is also the sponsor of several Medicare CATS workshops, where we provide you with 7 ways to mitigate, neutralize, or even bypass Medicare CATS. Look for them and participate. Last year, we published the book and audiobook, Private Practice PT Beyond 2020. This book provided information on many of the business aspects of diagnostic testing in a private practice and the impact they can have. A major clinical publication took place earlier this year, and it was the publication of the book Atlas of Musculoskeletal Ultrasound of the Extremities by our very own Dr. Mohini Rawat. But today, I'm going to make an announcement that is going to contribute significantly to the awareness level of our colleagues in regards to what we do and how someone can build a long-lasting, prosperous private practice business. We're releasing before the end of this year our new book, Private Practice Prosperity, Creating an Unshakable Future. This book describes in detail the 8 prosperity principles that each private practice must adhere to in order to have stable growth that can continue even at times such as the COVID-19 pandemic. This is a book publication that will be available for sale later this year from Amazon, Barnes & Noble, and all other major book outlets, and in an audiobook format as well. In addition to this publication, we're planning for 2021 the publication of the clinical book, A Guide to Medical and Physical Therapy Patient Management based on electromyography and MSK ultrasound testing results. This clinical book will play a significant role in medical patient management based on diagnostic results you produce, and you will be able to share it not only with your treating therapists, but also with your referring physicians. Our continuous participation in APTA events, the Chad Madden events, our book publications, and social media and marketing campaigns are projected to reach over 100,000 physical therapists, medical doctors, and other healthcare providers within the next 12 to 16 months. And a new announcement today. HODS has now partnered with 919 Marketing, a conglomerate in the marketing and branding space, and a major rebranding and new dissemination effort is underway that will help create massive awareness in the medical and physical therapy communities about the future we are creating for our professions. Secondly, we need to increase further awareness to patients and society as a whole. Our national PR and social media campaigns of www.findbestpt.com and www.emgtestnearme.com have been featuring the 185 HODS-approved diagnostic centers across the country, resulting in new patients and physician business to many of you. In 2021, we will be launching 4 major new campaigns addressing pertinent issues that the public faces on a daily basis: back pain, hand pain and carpal tunnel syndrome, shoulder pain, as well as knee pain and sports injuries. These campaigns, with corresponding landing pages, will target public who is searching for such problems and will direct this public for diagnostic testing and physical therapy to the HODS-approved network of providers. And this is a small sample of the kind of value that HODS franchisees find as members of our HODS community. And yes, this is how HODS and HODS partners help transform and improve conditions for both the PT profession and society. Our prescription is easy, and here is a sample of it.
The HODS prescription to help patients and advance your practice. To the future of PT, massive numbers of people receive information about their back, shoulder, knee, or other problems via social media campaigns. They get directed to www.findbestpt.com, where they choose a HODS-approved diagnostic physical therapy center. Patients arrive and receive a proper evaluation that may include the use of diagnostics such as EMG and ultrasound imaging testing. The physical therapist creates an accurate treatment plan using both data from clinical examination and diagnostics. This plan addresses the patient's real cause of problem with 62% better accuracy. Patients get better faster and they are able to regain back their function. Then they recommend the services to their friends, family, and their doctors. And this is how we create a huge positive impact to society.
Of course, this can extend to other areas of the healthcare system and society. More effective physical therapy can curb the use of medications. This can force the pharmaceutical industry reduce their prices in order to stay competitive in the industry. And this can have a snowball effect and make insurance companies decrease premiums. If the cost of care is lowered without expensive medications and with faster results from physical therapy, people will be out of pain faster and will be more productive, and productive people are happier people who do not have to use antidepressants and other drugs. And this, like the butterfly effect, creates a positive effect to many other areas of life, and it influences entire generations. I know. That it may seem a bit unbelievable, but I want you to just imagine the possibilities and to realize the effects you are creating every single day with what you do. At the same time, the HODS members, along with the students of our affiliate organizations, AACE and AAMU, have to continue the highest levels of competency in all areas of diagnostics that we teach and promote. HODS, AACE, and AAMU are the only organizations worldwide to offer a combined residency in electromyography and a fellowship in musculoskeletal sonography. And I'm proud to announce that this year's ECS board certified therapists, EMG diplomats, RMSK board certified therapists, and FMSK graduates will receive the recognition awards and credentials in a special celebration we have put together at the closing of today's event. So stand by for that. For those of you who do not know HODS as much as our current franchisees, let me assure you that hands-on diagnostics is not just the greatest opportunity for private practice owners and physical therapists to provide unparalleled diagnosis and treatment for their patients with the use of our advanced technology, nor it is just the means to wildly increase your profits and reclaim your time. What we do at Hands-On Diagnostics provides a brighter, more expansive future for the physical therapy profession far out beyond 2020. For those of you who are seasoned electromyographers, it is time for you to bring in your practice neuro-MSK sonography, and our organization, the American Academy of Musculoskeletal Ultrasound, has special programs designed just for you. And for those who are working for hospital organizations or are located outside of the United States, then both our organizations, AACE and AAMU, can provide you with the training that you need to help your patients with both EMG and MSK ultrasound. My friends, all of you stand at the leading edge of a major evolution in the physical therapy profession. And those of you who are not PT, just brace for a major evolution in the entire healthcare. Our generation of healthcare providers are the pioneers who will cure cancer, will send humans in Mars, and will make healthcare affordable and accessible for each and every human in this planet. At the hands-on organization and companies, we have many of the answers that healthcare professionals need. Just look at our strengths. We have the advanced technology, we offer outstanding mentorship and systems that allow for true professional autonomy and unparalleled patient care. That's why we have such a tremendous amount of pride and joy when we see you, our HODS partners, our AACE and AMU students doing well and really taking advantage of this revolutionary opportunity. So many of you have seized this moment. You are not beholden to the way that things have always been done, but looking to the future. When we first started HODS, it looked nothing like today. It was just me and my partner, Dr. Kostas Rizopoulos, along with our CEO, Greg Ferreira. Today, this is truly a family, one that has grown far beyond the scope of anything that we could have imagined. Now we have all of our amazing faculty and staff, our Deputy CEO, James Savas, our Senior VP of Education, Dr. John Lugo, our VP of EMG Studies Original Pathway, Dr. Mark Brooks, our VP of the EMG Residency, Dr. Greg Ernst, the Director of MSK Studies, Dr. Mohini Rawat, who is also co-founder of AAMU, our many senior faculty, such as Dr. Rick McKibben, and all of our other faculty and mentors that would take me a long time to talk about each and every one of them. All these people make sure that your learning experience is unparalleled to anything you have experienced thus far with any educational institution. Now, we have all of you, our HODS partners and AAC and AAMU students, hundreds of healthcare professionals around the country who are participating in this movement to change and bring healthcare and society to a better state. As a company and as a family of partners who are just getting started. The best is yet to come, and I'm glad you are here with us for the ride. To all of you who are daring to dream and who are creating the future of the healthcare professions, to all of you who are helping people change their lives in a more positive direction, to all of you who believe that it's time for diagnostics and physical therapy, we would like to dedicate this.
Because you're a physical therapist, you're not afraid to face pain. Where many see obstacles, you see opportunities. Because you're a physical therapist, you're always looking for solutions to your patient's pain, dysfunction, or disability. Looking at the surface of a problem will never be good enough for you. You're poised to tackle your patient's problems using every molecule of your body and every modern tool available to heal. Because you're a physical therapist, you're a scientist and a pioneer. You are willing to step beyond the crowd and lead the way. You dare to dream the future of the profession, a future where advanced diagnostic technologies of ultrasound imaging and electromyography are at your fingertips. Hands-on diagnostics helps you see your patient's pain. Together, we can create your future of physical therapy now. It's time for diagnostics in physical therapy. Seeing is believing. Join the movement now.
Thank you.